Hello, this is Dr. Bouvier with drnu.com, and I'm here with Mr. Syed. Dr. Syed, right?
Well, I'm technically a doctor in physical therapy.
Yeah, it's
but
cool.
Lots of MDs don't like us calling us doctors because,
I like it.
Because people get
I
confused.
like it.
Oh, thank you. You're one of a kind.
So you are the National Director of Therapies for Guardian Angel, correct?
Yeah, it's a big gulp right there.
Yeah,
right?
it's great. It's wonderful, and welcome aboard. It's really wonderful. So we're here today to talk about dysphagia and how to get everybody on the same page on training dysphagia, mainly for the caregivers, anybody taking care of patients, but also getting the nurses. The speech pathologists are kind of already on board with this, but I want to make sure that everybody understands how we're treating dysphagia from the hospice perspective. So diagnostically, we like to look at neurological and muscular things, right?
Right.
Any other etiologies, do you think, of the dysphagia issues?
Sometimes it could be, it wouldn't happen with a hospice, but sometimes it could have a TMJ
Right.
movement. But other than that, it's mainly come from neurological or muscular.
Right. Or joint.
Right, TMJ.
Yeah, right.
know.
So, the treatment is basically the same. If it's etiology is both the same, but we see that in hospice as things in the Alzheimer's patients and even people in not actively dying, but getting up to that point. There's basically some simple things that we like to do, and listen up close. So we like to have chin down, swallow twice with every bite. We try to get the bite situated where it's a good size,
Right.
it's not too big. Some people tolerate thin, thicker, and solids better, so we like to follow each bite with something that they are comfortable with. Remember, the CVA patients, they'll pocket stuff on one side they don't feel, and they'll swallow, and they'll initiate the swallowing mechanism from the good side. So you kind of have to remember that and identify that. So it's chin down, swallow twice, and then take a drink of whatever works for them in between each bite, and that kind of helps people understand how to help with the dysphagia. Is there anything else that we should include in this video?
Also, one thing you want to make sure is before you give them another bite, they clear their throat so nothing gets stuck there.
Oh,
You know
like
what I mean?
like from where they might pocket?
Where they might pocket, or they might have if the liquid is not proper, it might get stuck there and use it. And when they cough, you'll hear coughing, or them talk. It'll sound like it's phlegm, but it's not really phlegm. It's
Good
like
point.
liquid. So you want them,
So good point too. If they're coughing, and that's another way to look for to identify dysphagia is that whenever they're eating something, they're coughing.
Right.
And a lot of times their tendency is to want to go up when they eat or drink, and it's get a straw, give them a cup, chin down, swallow twice. You swallow twice to make sure the clearing is correct.
Morning.
And then follow it with the drinks. Follow solids with the drink. Many times we're using thickened stuff anyway. So again, this is Dr. Robert Bouvier. Dr. Said, thank you very much
course,
for
thank you so
coming
much,
in
sir.
today,
No, of course.
and love to have you on board.
Thank you so much.
Take care.